So shoulder pain is scary, and shoulder surgery sounds even more scary, but it may be the solution. It may not be the solution. For many adults over 50, the decision isn't so clear. I will tell you what your surgeon might not be saying and how to know what's right for you. Hey there, I'm Dr. Dan Orcutt, orthopedic surgeon. I've helped over 1,000 people recover from shoulder injury and shoulder surgery. And this is the place where I'll help you answer the questions that you have. If you're dealing with pain, prepping for surgery, or recovering from surgery, I'll break it all down so it actually makes sense. No fluff, no pressure, just real expert advice on how to help you heal. Smarter and faster, hopefully, with a little less stress. So let's get into it. So rotator cuff tears are extremely common as we age. In fact, by the age of 70 or 80, more than 1/3 of people have a full thickness rotator cuff tear, and many don't have any symptoms at all. So we may think an MRI rotator cuff tear means doom, but half the tears never hurt. Here's the emotional reality of it. You've had an MRI, you've told you had a tear, and now you feel doomed. But pain and function actually matter much more than the scan. So take a deep breath, because not all tears are created equal. Symptoms matter more than the scan. So question, have you been told you have an MRI tear that needs surgery? How did you feel? Did you feel frustrated? Did you feel validated? Were you happy that there was something actually wrong? Were you sad that you had to have surgery, or you think you have to have surgery? Drop the comments below. Let me know. So most adults over 55 respond very well to non-operative treatment. Still treatment, just non-operatively. Physical therapy, careful exercise, maybe an injection, all aiming to reduce pain, restore motion, and get back to what matters in life. That's one key question. What matters to you in your life as far as physical activities? We know that therapy improves pain and the movement in most people, right? If that movement is enough, that's great. Sometimes it's not enough. So success in about 75% of cases, even with a full tear. There's some long-term studies showing that about 75% of patients with chronic full thickness tears improve the conservative care. Again, no surgery, even at the 5 or 10 years follow-up, long time out. But tears can enlarge over time if left untreated. So we need to be aware of this. For some older adults, surgery does provide better improvement in the first year, less pain, more strength, especially for tears that are larger or people who have high functional demands. So it's key question is, what are your demands? What do you want to do? What do you need to do? So however, in people over 75, surgery still can lead to high satisfaction rate and meaningful function gains if you have high function or really bad tear. But re-tear rates are higher, even if you fix them, and healing is less predictable in the older population. So older tissue doesn't heal quite as well. Think like the difference between a tissue paper, easy to rip, and thick rubber. And that tissue paper is sort of what we have in the older population. Some people anyway. So tissue quality matters, not just the tear off the bone. But many still see pain relief and better motion if you have surgery. So the reality check is, surgery isn't magic. Risks are stiff, slow healing, potential re-tear, post-surgical pain, long recovery, all the other risks we have as we get older, especially if your tissue is degenerative or it has fatty or atrophy like we talked about above. If you want to know about that, click the link below for a detailed video that I made on fatty degeneration of the rotator cuff. And it really affects how we fix or whether we fix it all. Recovery takes months of rehab, even a year for full gains or the maximum improvement. If you're going to have surgery, check the link below for our recovery pre-op checklist. Okay, let me tell you a quick story about Martha. Martha's 72. She was retired, lives to gardening, loves to spend time with her grandkids and her great-grandkids. She came with a painful, full-thickness rotator cuff tear seen on the MRI. Dominant arm, the MRI doesn't look so good, retracted rotator cuff tear, but we started a conservative plan, physical therapy, activity modifications, and some targeted exercises at home. Within 3 months, her pain was much improved, still present, but much improved. By 6 months, she was planting tulips, lifting her 3-year-old without a wince. No surgery, no rehab, just a smart plan tailored to what she needed. She wasn't high function. She didn't need to go back to work. So sometimes surgery isn't needed in that case. Martha's story isn't rare. It happens when we treat the person, not just the MRI finding. And that's important. All right. So are you still with me, even beyond what we talked about so far? Good, because next I'll show you exactly how you decide if you should have surgery. Here's how to decide what is right for you. We need to track symptoms. If you can perform functions and your is minimal in your pain responsive therapy and gradual rehab, maybe it's smart not to have surgery. Partial tears often heal or improve with non surgical care. Also, we need to know what your goals are. Do you want to lift your grandchildren? Do you want to swing a golf club? Do you want to return to a high level activity? This matters in how you would decide what to do. What structure is at risk? How big is the tear? How far is it pulled back? How hard is it going to be to fix? How bad is the tissue? Those are all important questions we should ask from the MRI before we make that decision for surgery. Also, we have to be aware that a rotator cuff tear can grow, can enlarge over time, and that can create functional declines. So if you decide not to have surgery, and then as time goes by, you're having decreased function, increased pain, then it may be time to reconsider surgery. The key thing, though, unfortunately, is a repair of a longer term tear, unfortunately, is not quite as good as repair sooner after injury. And so that's the key that we have to weigh those out. Should we have surgery soon because it's going to be better than a long-term surgery? Or do we not have surgery because our function is still pretty good? So most times we choose careful timing. Most guidelines, especially in the older population, suggest starting with a conservative therapy unless symptoms are severe or the tear is acute and large. So if you're over 55 and facing shoulder pain, this channel is made for you. Hit the subscribe, hit the like. I'll walk you through every confusing part of this recovery step by step. Rotator cuff tears, total shoulders, reverse total shoulders, even surgery. If that ends up what you need, we can help you. We will begin with conservative care almost always. There's no rush, but we also have to be very aware if symptoms worsen, meaning that probably the tear size has increased, then we need to get you back in. We need to see you and make a decision on whether we should have a surgery at that time. So many seniors feel ignored by the system that pushes surgery too fast. We're going to be gently challenge that with informed patience and clear purpose. Unfortunately, some surgeons either want to do or they don't want you as a patient. If you get that vibe, it's time to find a new doc for sure. Don't be pressured into surgery just because that's what the surgeon does, right? Sometimes surgeons think that everything looks like a nail because all they have is a hammer. We want to make sure we have a surgeon who has lots of options for you. So what your surgeon might not be saying, right? You have a tear doesn't mean you need surgery necessarily. Conservative care isn't lazy. It's smart, data-driven care that often works and prevents us from having a long, painful recovery. Early surgery isn't proven. Many studies show equal function even after 2 years, whether you had surgery or not. However, if you have a big tear, it may be the right thing or poor function, right? Secondary surgery after failed conservative management doesn't work quite as well as early surgery. So we have to weigh those two out. So what truly matters? Your pain, your function, your quality of life, and creating a plan that fits those, not just a scan. So if you're over 55 facing shoulder pain or rotator cuff tear, here's what to do. Start with guided exercise, rehab, maybe an injection, and monitor your symptoms. Keep the imaging discussion in context, right? The imaging is only a small piece of the whole thing. And have honest conversations about your goals with your doctor. Surgery remains an option, but not necessarily the only option, or the best, or the first one. So, I'm Dr. Dan. Thanks for watching. Stay strong, stay smart, and we'll see you next time.